Welcome back to Good Things Utah, everybody. Lupe Cruz is joining us now from LDS Hospital. And ladies out there, I swear you probably asked yourself this question or your medical provider. The #1 question Lupe gets is, do I need a pap smear? How often? And what is it?
Right. So first of all, do you need one? It all depends on your age, what your past results were. So we kind of take all that into consideration before deciding if you need one.
Well, this is part of your regular health screening when you go and visit your doctor, but do you find that many of us don't know why we're doing it and what it's actually looking at?
Yes, exactly. So what we're looking for is abnormal cells. The pap smear is the #1 way to find cervical cancer. So, and it's very treatable if it's found early. So we do these screenings so that we can find it early and treat it. We are looking for, #1, abnormal cells. We're also looking for what's called HPV, human papilloma virus. And that, it's a sexually transmitted infection. It's very common, and it is what can cause cervical cancer. So we look for both of those things.
So when you give someone their results, do you say clear or do you say abnormal cells? And what does that mean then?
So you either have a negative result or a positive result. And it kind of sounds funny because a negative result means it's good. Positive result means you have some abnormal cells.
So negative is good in this case. Okay.
Yes.
And then what does that mean if you have abnormal cells for you?
Abnormal cells, when you find out that you have abnormal cells, it means we have to do further testing. It doesn't necessarily mean you have cancer. You know, we have to do so much more before we get there. And unfortunately, some people hear that they have abnormal cells and they don't know what to do. They have a meltdown. Sometimes they cry. And like,
well, that would stress me out.
Yes.
I mean, that would. It just means more testing at that point to see what that is. Could it be something other than cancer?
Oh, yeah, it could just be some abnormal cells, and your body can take care of that some of the time. So what we do is we schedule someone for what's called a colposcopy, which kind of sounds a little bit scary to some people, but what it is we're looking at the cells a little bit closer with a different type of, it's called a colposcope. It's like a microscope, so it's a different type of a tool that we look at them.
Okay. How important is it to get screened? I mean, I know cervical cancer is preventable if you catch it early.
It is. It's very treatable, and it's one of the most treatable cancers that there are if it's caught early.
So that brings us to the screening guidelines. Let's go by age here. Who should be getting screened and at what age?
So you don't need any screening at all before the age of 21.
Okay.
Okay. And then from 21 to 30, we screen. We screen about every 3 years if you have normal results. So if you don't have anything. You don't have to be screened after 65 necessarily, between like 65, 65, 70, you don't have to be screened. If you've had a hysterectomy, you don't have to be screened unless it was a hysterectomy due to some cancer.
So you mentioned 21 to 29. What about 30 up to 65? How often should they be screened?
So about every 3 years. If you get 3 consecutive normal results, you can even go up to 5 years.
If your doctor, when you go in, because I go in every year, I like to just go to my normal regular health checkup. If they offer to do it every year, should you? Can it hurt you?
It's not going to hurt you, but the guidelines have changed, and it will get to the point to where the insurance company's not going to cover it. Yeah.
That's the issue, because they want to cover it every 3 years, especially if you've had a normal result. If you haven't had a normal result, how often should you have it done?
So that depends as well. So depending on the result you get, you might have to do it yearly, do a follow-up yearly, or your provider might say, we're going to come back in 6 months and check again. So depending on what we see, the abnormality, whether it's mildly abnormal or a little bit more abnormal, then we're going to ask you to come in more regularly.
Lupe, are we nervous to get these done?
Yes.
Do you find
it's not comfortable.
But I would say that's it, just a little bit of discomfort. I would say that's it.
Yes, some discomfort. And if you do have abnormal results and we do see more in the colposcopy, then you do have to have a biopsy,
okay,
which is, a little piece is taken at that time, and then we send it to pathology to have them look at it.
I love that you said this is so treatable if you just get this checked. If you have any questions, Lupe is happy to answer those. She's with LDS Hospital. That is their website. Please go to our website and we will link you to all of their information along with their website sitting right there on your screen right now. Lupe, thank you so much.